I think that we can start this session. Thank you very much for coming. I mean, this first session on this first block is dedicated to EOSC and the European health data space. So it comes very timely with the discussion that we have had right in the plenary sessions. So first of all, just to insist that also for the people that are online, and you, if you want to record and put your questions there, just to be sure that we can get access to them if there's no time for you to answer, go to Slido and check this number, 7111054. That will be the number that we can use in Slido for the questions in this session. So let me briefly explain you a bit which is the outcome of this, or the outline of this session. So as you know, or as you probably know, the European health data space is an ecosystem that defines rules, that defines the standards, defines an infrastructure and a government framework for the management of health data. They have several areas, of course, with primary use of data, for empowering also the citizens the control of access to the data. What is more important for our community, for setting up a trustworthy environment for the secondary use of data for research and innovation, and also some requirements related to interoperability. So we have started an action of exploring connections, gaps, in relations, commonalities between the activities that we have in EOSC and the health data space. So I'm very happy to have here in this session today very high-level speakers that will also provide a very brief overview of their views on this framework, and also be ready for our questions in the panel. So we will start with a very, very brief setting up the scene of what is going on related with health data in the context of the EOSC partnership. EOSC partnership means association and infra-EOSC projects. Then one of the two co-chairs of the health data task force that has been commented by Carol in the presentation, Peter Holub, will make a short presentation of the activities of the task force. And then we will have a roundtable with, along with Peter Holub, with three other persons that will complement quite well the spectrum. First, starting with Jérôme de Barrons from the European Commission, which is, one of the persons, DG Santé, deeply involved in the implementation of the European health data space. That will give a short introduction on that. Salvador Capella from EOS for Cancer, that is one of the infra-EOS projects in related of health, and Antonio Scarmeta, who is the coordinator of EOS Titan, which is a project related to secure computing and secure processing environments that are also key for this scenario. So I don't want to take more time of this, so just to remind you that the construction of EOSC deals with this tripartite that has several points for working, that in the EOS Association and the EOS in general, we define it as strategic research innovation agenda that defines some of the points that are key for the work programs. Through the MART, you have seen this already. And just to tell, from this big community of members and observers, who of them are related to health? And we can see that there are research infrastructures, ERICS and other research infrastructure members of the EOSC Association that are related with health, as well as other research performing organizations that are also in the health domain, plus more than 25 multidisciplinary research performing organizations in which they cover also health as one of their domains of health. So there is a deep involvement. Carol already presented. There's this activity of health data, this new task force on health data, and we have Peter Holub here that will present, that is dedicated to analyzing these gaps between the HDS and the activities in health in EOSC. So just to finish my short introduction, let me point out that it is not only the association, of course, the infra-EOSC projects are key, and we, from this big list of projects that have been founded and has been also presented today in the summary, there are projects that are related to metadata and ontologies. Maybe this is an incomplete list. There are projects that are related to building the EOS Federation, projects related to secure environment, and projects related to the health domain by themselves that are key for the implementation and relevant to HDAs, as well as other projects that are working on fair services, which also contribute in the or have some commonalities with the needs in the HDS system. Whoops. So with no more delay, I would like to pass the floor to my colleague Peter Holub that will make a presentation on the activities of the Health Data Task Force. So please, Peter.
Thank you, Nacho, for the introduction. And actually, it will be a relatively brief presentation. We have only 10 minutes, and this is also because the Health Data Task Force is now more or less starting its operation. How many of you are have ever processed health data for research purposes? Can you raise your hands? Nice. That's a significant portion. By the way, how many of you have ever driven a car with manual transmission? Okay, so maybe we have a common understanding. Then before we are changing gears, we should make sure we rev up sufficiently, because otherwise the engine stalls. Yes, the common service, this Health Data Task Force is basically trying to find where we need to rev up, where are the gaps, and how to align them across different European endeavors. It has been published by the EOSC Association, a call for the Health Data Task Force, was published with the goal to focus on the interoperability and sharing of health data and services and alignment with EHDS, the European Health Data Space. And is covering a number of topics related to EOSC strategic research and innovation agenda. And the most important components that were specifically requested by the EOSC Association were identification of process models. I would refrain from using word business in this sense, because it can, with health data, can bring also the unwanted connotations. So process models of health data research projects, understanding their limitations and capabilities, and how they can be incorporated in the EOSC. Another objective was to map and align health research projects to EOSC services. Another was proposed solution to enable alignment with different EOSC actors between different players in the domain. And I think most of you who ever had a chance to process health data know that this is intrinsically difficult area, because there are many players. It's not just researchers that are united under EOSC. It's healthcare providers. It's different wellness apps that are collecting a lot of health data. They have different, there are of course research groups that are generating a lot of data. So these have different goals, they have different governance structures, and there are major European endeavors now evolving, such as the EHDS, the European Health Data Space, that will even further change the landscape, the legal landscape for sharing and processing the data. Because out of the sudden, we will have even different legal bases than we had so far for processing the health data beyond informed consent and legitimate interest and other things. So how those different players in this field can contribute and how they can align, and then of course build and develop the partnerships. We are co-chairing this Health Data Task Force together with Lene Kroll-Andersen, and greetings for her. She couldn't participate here physically, unfortunately. And we have quite a few members covering many European countries. We have some gender balance and also some nice overlap with the EOSC Association membership. And so far, in the first steps, because we had basically the first two meetings, we started to align on the terms of reference. This is very basic document of the task force that defines the common goals, what we want to be on those formal goals that we inherited from the EOSC Association, how we make them more concrete, and how we turn them into activities that we will pursue and what deliverables we are going to deliver. So because this is very, say, complex environment, first of all, we need to map different stakeholders. I mean, most of us in this working group have overview of some part of the ecosystem. We might be missing some other parts. So getting a collective information about or knowledge about different stakeholders and putting all of that on one information system or pile, and then start identifying gaps and redundancies and then possible synergies. As I've mentioned, with EHDS coming, there is now a lot of movement on the national levels. There is a lot of projects, not only around EOS, there's a lot of projects around EHDS, such as TEDAS2 EHDS2 pilot, code of practice groups, trying to bring together the country representatives and the people from the countries that are then practically implementing EHDS. There are data spaces being built other than EHDS, such as EUCAIM, European Cancer Imaging Data Space, and GDI, Genomics Data Infrastructure. And this then also relies on, in many cases, on the existing European research infrastructures. And given how many different solutions are already either being developed or readily available, given how many stakeholders we have, for instance, in this semantic data interoperability, which is like Odyssey that is defining OMOP, which is HL7, which is defining FHIR and then developing FHIR profiles, we need to identify what role should be there for EOSC, and if there are any gaps that are to be covered, and where EOSC would be uniquely positioned to cover such a gap, and redundancies, because there is a danger that there are people working on semantic interoperability from the theoretical perspective, that there are others working on the same semantic interoperability from the healthcare side, and how do we make those into synergetic efforts? And then, as the last step, defining the strategic view of how the EOSC should support health data domain. And this basically corresponds to the three deliverables we have defined. So the first one has already been drafted as a part of these terms of reference. So the strategy and work plan. Then working on identification of stakeholders and the gaps and redundancies analysis. And then the last one is corresponding to those those activities I've mentioned, is the development of strategic view. If you look at the timing, the identification of gaps is planned for the mid next year, and then the strategic agenda, strategic view of EOSC supporting health data should be in the middle of 26. So that is it in the nutshell what we are going to do in terms of working methodology. I think that is similar to every other EOSC task force, so working on mutual respective basis and trying to achieve consensus, organizing workshops, co-locating these with other relevant events, and especially in the health domain, there are so many different stakeholders, so also events are much more than just EOSC-related events, and we need to make sure that those communities are getting interconnected. So that's it from my side. As I said, it's just the intro because the task force is starting. And keeping in mind how challenging that landscape is, please, those of you who are interested, who are participating in the task force, I would like to ask you for very active participation because we need to move ahead reasonably quickly. And starting with those mapping exercises, say, well before the end of this year, so that we can produce that identification of gaps, redundancies, and synergies by the mid next year. So that's it from my end. Yeah. I've made it
Yes,
even on
so
time.
I think that, yeah, thank you so much for being on time. I think that we can get the questions for the panel, right? So, and then we can move to the next part. So let me just one second, if you click, just give me 1 second.
This one?
Yeah, so we will have 3 more presentations now, 3 presentations from 3 different angles. One, we will start from Jerome de Barros from DG Santé that will give a short overview of the whole European health data space. This is a very important, presentation to setting up the scene, understanding all the regulations and the different actors, and how EOS can play the roles there in this mapping. Then we will be followed by a short presentation by Salvador Capella from EOS for Cancer, one of the key activities in health and EOS that we have. And finally, we have Antonio Escarmeta, which will make a presentation on secure processing technologies that we will see that is a key point. So first, we will start on Jerome. Jerome will share the screen by himself. And maybe we can swap to and hear him. Do we? Okay, Jerome, so you have a little less than 10 minutes to present the HDS, please.
Thank you. I'll be very quick. And first of all, sorry I wasn't able to join you all in Berlin, but I hope that these presentations can at least provide a bit more overview to the points you already touched on and that Peter followed on with. So I will present the HDS, and as you mentioned, when you talk about the European data space, it is a framework for those 3 key objectives, primary, secondary use, and the requirements for the electronic health record systems. But for the sake of today's presentation, I will just focus on the secondary use. And when we talk about secondary use under EHDS, so these are the elements that are relevant here. So these are the rules that you mentioned on who, so what kind of users, data holder, has to make what kind of data available, for which purposes, and then setting a series of conditions under which this access is provided. One important part you mentioned about EHDS is that there is no need for consent to access the data. We only provide the possibility for citizens to opt out. The idea was to provide legal base. And with the additional safeguards that we are providing, not having to rely on consent for access to the data as a legal base. EHDS is also an infrastructure, health data TU. So that's the infrastructure for secondary use of health data. And one important part, reusing the FAIR principle, the F in FAIR, the findability, one of the important part is to offer data catalogs, available data sets. So any data holder, so entities that qualify as data holder, would need to provide a data set descriptions that is then integrated into those data catalogs. The idea is to make it easier for any users, be it a researcher, industry, a policymaker, to, in the first instance, identify what kind of data is available. And then it's providing a process. It's done through data permits mainly, and that really specifies how the data will be made available and used, and what kind of safeguards are put in place when data is made available through EHDS. And those safeguards are those. So when data is made available through EHDS, it is only through a secure processing environment. So, it can be referred to as a trusted research environment. There's many ways to refer to those, but the idea is that it is a space where only authorized users can access this data, where this data is only made available in an anonymized format, and where no personal health data can be extracted. We also have additional safeguards by proposing the governance that we'll touch on later, defining who makes access to this data, public transparency on the data processing activity. So every permit that is issued is then public, so that we know who had access to which data and what were the results. Also transparency when it comes to the outcomes. So One of the safeguards is obviously to introduce this opt-out that I mentioned here. Unlike in GDPR, there is no need to state for which reason. If a person just doesn't want their data to be used for secondary use, they have the right to express this preference. And finally, the principles of the minimizations and purpose limitations of course apply to EHDS here. And here in a nutshell, this is what EHDS will enable. The catalogs I mentioned before, this is the part where that's supposed to data discovery, helping any user to, in the first instance, understand what kind of data is available, and then may support the research. Once relevant data has been identified, so relevant data sets, is a process, a permit application, where a user asks these questions: can I use this data for my permit? And this request is placed to the health data access bodies. As I mentioned, one of the additional safeguard is to have an additional layer of governance. In this instance, EHDS proposes to have the establishment of health data access bodies. Those are national agencies responsible to give an answer on, can I use data for my research, or issue a permit when this request is valid and the whole application is sound. When this is approved, this is when health data holders, so those that have the data, are mandated to make this data available and placed in a secure processing environment so that the user can have access to this data and is able to analyze it and process it according to what was established in the permit. Finally, what's very important, that we want to have as much transparency as possible, and we expect publication of results so that not only do we know what kind of outcomes came out of this research and what kind of access was made, but also to facilitate verifiability by third parties. And to make this possible, as I mentioned, EHDS also proposes an infrastructure. The idea is to have an infrastructure that, in the first instance, makes it possible for those health data access bodies, so those national agencies, to communicate with each other, to be able to receive those data access applications made by the users. We also foresee the participation of other participants. For example, EDICs and ERICs, so these are the legal entities of some of the European research infrastructures, for example, but other data sharing infrastructures might be considered as well. We obviously have the European agencies, for example, think about the EMA, the CDC, and their data will also be made available through this Union Data Access Service. The idea is that there is a national agency, every access body in every country, and there will be one for union data, so data held by union agencies. And finally, we also foresee the possibility for third countries, international organizations to join the infrastructure, providing they, of course, apply the rules set in the legislation. So really, this idea is to really have this infrastructure to facilitate this access, communications among the actors. So, and here we have just a brief timeline of where we are with the legislation. So starting with the entry into force. So at the moment, we reached a political agreement with the European Council, the European Parliament. And right now, what was the proposal from the European Commission, what is the agreed text now, is with being translated into all the different languages, tidied up, and the idea is that will be available and published in the European Journal beginning of next year in principle. And this is when the European Data Space Regulation enters into force. We then have 2 years for certain implementing acts. So the implementing acts are additional information.
It's us or them?
Is finally
Sorry.
able to access or to request access to data using the HDS framework, and that will be the beginning of 2029, so 4 years after the entry into force. And another mention, so if you look at the red box at the bottom, you see there's another arrow in 2032. That's where the obligations deriving from HDS starts to apply to certain categories of health data, genomics and other omics and wellness applications. This other arrow below it around connections is from 2035 on. This is when third countries may apply to be a member of the HDS. So now, as I said, we are at the stage where we are about to have the adoption of the regulations, but we already started work for quite some time to make it a possibility that in 2029, we are able to have infrastructure put in place, the governance actors that we identified ready. So that's why we had a series of projects, to pilot the infrastructure, to support the member states with the establishment of those health access bodies, to develop the central services. These are the elements that are run by the Commission. For example, I mentioned before the catalogs. So there will be national catalogs that are then federated into a European datasets catalog. So this catalog is then, for example, run through those central services or series of services that are run by the commissions to make the whole framework work. We also have activities around capacity building, and an important part is the data quality and utility label. The idea is that when a data holder has one of the types of data identified in legislations, to prepare dataset descriptions, so very brief description of the dataset for datasets with which public funding was used to either collect the data or to process it in some shape or form. Then there's also the additional obligations to prepare the data quality and utility label. That is a much richer metadata description of the dataset, including its utility, so its relevance for different kinds of uses. And we have a specific project developing this label. And finally, we'll have also very soon a project, I think that's quite relevant here, that is around stakeholder engagement. So we will have a project that will help out, first promote what is the HDS to wider communities, but also start to facilitate engagement so that we are able to ensure that the HDS evolves in a way that really addresses the needs and any kind of issues that users might have encountered. And actually, I think I'll stop here and leave the floor to Salva, if I remember well.
Thank you so much, Jerome.
Okay.
Thank you for this presentation. So in this federation of actors, that is the HDS, this is very important to see that research infrastructure are also considered authorized participants, so there's a clear point there for connection, all the efforts on finability, metadata specification, and quite aligned what we have, as well as for the processing environment. So let's keep, please put your questions in the slide, and we will address at the end. So very quickly, we move to Salvador Capella, who will make a very short, please, Salva, presentation on EOS for Cancer, framing the activities on this project who is co-coordinating. Please, Salva. We don't hear you. Maybe you're mute. Can we check? Please keep on talking. No, we don't hear you.
Can you hear me now?
Yes.
Yes, now we can.
Perfect. Thank you for the invitation, and apologies I cannot join you in person in Berlin. But let me introduce EOS for Cancer quite rapidly. EOS for Cancer is a project that has been running for 2 years now, and it was designed when ESDS was under discussion. So we have elements of ESDS, but it's not at the core of the project. But what is at the core of the project is the use cases. Use cases for us are key, so they are the drivers of the project. and the use cases are organized along the cancer patient journey. So we want to cover all the different data types that are used along the cancer patient journey, from the risk and primary prevention to the early detection to the diagnostic and treatment of metastatic cancer. Those use cases force us or drive us to look into databases, knowledge bases, workflows, secure processing environments, and many other practices that at the end of the day, many times has to do with the interoperability of data. That is one of the key elements of EOS. So those particular areas of the cancer patient journey translate into 5 use cases for colorectal cancer. We choose that particular cancer because the availability of data along the cancer patient journey. So there is a lot of data. So there is a lot of cases, and actually it's a disease with a really good prognosis. So we can capture and follow up patient along the whole journey from the very beginning when we are working with cancer registries until the very end when we are working with clinical decision support systems. So those systems that help to understand, to bring together different data types to take clinical decisions, and usually they are known as a molecular tumor goals. So those 5 use cases are somehow connected or driving the development that we are doing along the project. So we have 7 work packages. We start in work package 4, the use cases, and then we go back and say, well, if we want to analyze a particular data set and so on, how do we do that? So we can have more visual or user-friendly interfaces like the CBio portal or the molecular tumor board portal, but also we can go a little bit down to more data scientist-oriented solutions like Galaxy, DataShield, OpenUberRe. So those are virtual research environments where we have defined workflows that allow to process the data. But of course, to process the data, we need to understand how the data is being presented, which standard, which common metadata are available, and how do we combine those data, because sometimes they are not in a single place. So we need to bring data together. And bringing data together means that we need to understand where it is, and it's not just data sources per se, but also knowledge databases. So how do I interpret a given variant? How do I get information about the pathogenicity of a given variant, and many other relevant information that provide the context to that data that I'm analyzing. So here we have work package 1 that is about the data space, to say. Work package 2, going back to the use cases, how we combine those data sets, how do we put together, how do we do the real analysis and present the information to the researcher until we get back to the work package 4. Of course, we shouldn't forget training. That is a relevant element here if we want to have the capacity to disseminate and to show how we are doing the work in for cancer, and how do we construct, how we generate a broader community, how do we do capacity building. Going a little bit forward and just to trying to get to the end of this very short presentation, EOS for Cancer have 5 main objectives. The first one is about enabling storage, access, sharing, and analysis of research data and other digital objects. So we are not just talking about data, we're talking about software, we're talking about standards, we're talking about workflows. How do we interconnect them, and how to mobilize them, and how to understand the rules that allow us to move or not data? So if it's data under access control, we need to use a federation of different sites. How do we make the whole analysis component accessible to basic and clinical scientists, meaning people who are not used to work in a command line, but prefer to use with interfaces? That means using analysis portal. And also, how do we enable the work of artificial intelligence and machine learning in such a reproducible way? So reproducibility here is another important aspect that connects us to EOS. So at the end, those elements allow us to contribute to the European data space in the sense that people in the cancer research are using data on this. What are the expectations to use it? What is the secure processing environment, for instance, and so on. So the different level of anonymity of the data. The European Open Science Cloud, for obvious reasons, we're all the time talking about data, about interoperability, how to make the whole ecosystem fair, and also to the European Mission on Cancer. How do we have an impact on research that is happening everywhere across Europe. So just to close, EF for Cancer is not a project that is working in its own, but it's very much connected with different projects around the idea of standard services, software, and portals. How do we deploy them and where to deploy them? And to be able to demonstrate the deployment of those infrastructure, of those elements, we do it through the use cases. And that is done in collaboration with UCAIM, GTI, probably the two reference infrastructure being developed at the moment, but also looking at global standards, that is the Global Alliance for Genomics and Health, and looking at the development of ESDS, in particular the ESDS2 pilots, where we have different use cases that can tell us, look, the way to build a catalog, for instance, is using the CAT AP, just to put a simple example. Looking into the EOS ecosystem, we have been very much looking at working with the Neuroscience Gateway and the connection with Galaxy. How do we do that? With Elixir Converge on the RDM, the research data management practices, particularly the RDM kit, and of course, many of the elements that we are using in EOS Cancer were initially discussed in the EOS Live, where many research infrastructures work together. Just to conclude, there is not a single effort of a single research infrastructure of a single institution. We are many, and there is a special case for research infrastructure as a way to maintain the knowledge and the infrastructures that are being developed here through the different projects, just how to make those development sustainable over time. With that, thank you, and I'm happy to continue the conversation.
Okay, thank you very much. So very clear this part. I mean, that dealing with research data, prepared data sets, as well as I mean, not opposite, but in complementing what HDS is also aiming at having the real world data from the patients. So as you have seen, processing environment secure processing has been mentioned several times. So we have here Antonio Escarmeta on the stage. He will present very briefly to the Titan. The Titan, EOS Titan project, which he will present, but it's related to trusted environment. So please. Okay, first of all, thanks for the invitation. I will say themselves. In this case, I'm going to present basically one of the three projects. Was at the sister project, no? That we are basically touching similar stuff. So I will first show you in general basically what are the main objectives. Several of these objectives are similar to what the other projects also are trying to achieve. By the way, there will be a next session after the coffee break where we will cover this. But in general, I think most of this project, what we are trying is to try to engage in the EOS framework the different ways where in order to manage and to treat data in a confidential way, in a privacy-preserving way, and provide solutions that help specifically the control of in the access to the data, but not only in the access also, but in the transfers and in the processing, I would say, of the data in that sense. Okay, so at the end, as you can see here, for example, in our case, we are obviously taking into account technical, administrative, architectural, legal aspects also that are related to how to manage this kind of sensitive data and the confidential computing in the context of the EOS interoperability framework. But basically, our main target is to develop, in one side, how to provide tools that facilitate the secure transfer and data sharing in that sense, and how to provide a secure environment so that you can execute processing of the data, specifically focused on machine learning in that sense. So basically, these are the two main components. The good thing, and related to this, I was at the session, is that one of the use cases that we have is about health care in that sense, as you will see later. So that's why also we are quite interested on the discussion that is happening about this data environment like EHDS. So basically in our case, just very shortly here, you can see we have two scenarios. One about confidential data sharing of sensitive data or government data, mostly focused on the agriculture, in this case agri-food. And the second one, as I already said, is the application of machine learning to the healthcare, specifically for data that are being provided on the clinical environment. That's for that. You can see here, basically, we have, our organization of the project. Basically, most important are the blocks that you can see here, where packet 2 2, 4, and 3 and 5, that basically are the building blocks of the enablers that we will use in order to provide the solution in this context. I jumped this because later we will come there when we are coming the next session. But basically, I think I take these sets of sentences from the previous presentation, indeed, saying basically what is being said about the secure processing environment. Okay, so basically it is the objective, and I will center on this one because basically it's where our project is mostly focused. It's basically to provide this case of a secure processing environment safeguard, basically to control the access to the data, so that only authorized users are able to access the data. But not only about the access to the data, but also to provide mechanisms to do aggregation, anonymization of the data so that they can be shared, basically in some sense, in that way. And additionally, how to provide data minimization. So at the end, in some of the cases, also to provide only the necessary data that is required when you are doing this kind of processing in that sense. So basically, all these elements that you can see here, data access, control for the data modification, aggregation, anonymization, etc., is basically what we are trying to do in the context of Titan. So basically in Titan, and here I put basically just a summary of how we are envisioning basically these kind of things, is that we are, and I put it on, I would say like different steps. We are trying to implement a solution, in this case an architecture, that should be compatible and interoperable, I would say more than compatible, interoperable with the EOS IF, where basically we should be able to allow consumer and producers, when here I put consumer and producer, you can see here could be data, processing, confidential processing, machine learning algorithms, or whatever is able to offer a service in some sense, and the service could be a data, but or could be a processing, how to describe their properties and their capabilities in one sense, but also how to describe what are the conditions to access to them in that sense. So not only to the data, but also to the processing capability in that sense. And this should be integrated. In our case, we are focusing, and this was in the proposal, to the use of a certain authentication authorization framework that is based on self-sovereign identities and the use of DLTs in order to provide compatibility between what is being done in EOS, but also what is being done on the Data Space Business Association, where basically they are focusing on the use of Gaia-X and this kind of technology in that sense. So how to bridge basically, and this is something that we already have started discussing with some people already in the EOS framework. And then the second aspect is how to provide the matching, I would say, between the offer and what are being offered and what is being consumer in that sense, so that we can identify how this process should carry out. So how to identify what are the requirements, so that if we want to share the data, if we want to do certain processing of the data, what will be the processing needs that will be behind that. For example, how to define who is allowed to access the data, what needs to be provided from the point of view of a credential in order to access that data, and what kind of processing will be required in the data. For example, anonymization in that sense, or any other processing, for example, data minimization. For example, one of the issues that we are doing is self-sovereign identity using privacy-preserving technology, so that allowed to control also what information is going to be shared and to whom is going to be shared in that sense. And how all of this obviously should be integrated, I would say, on the context of the sharing schema that we are proposing. And finally, how to integrate on this scenario the confidential computing capability of the nodes. So one of the topics that we are envisioning is the possibility that we, as part of this capability that being offered, is the possibility to say, okay, I'm able to execute certain operation, but also providing, for example, a secure environment, in this case, like a TEE or any other secure environment, where this processing will be happen, or where your machine learning algorithm will be executed in that sense. For example, using scenarios like a secure enclave, federated learning functions, or whatever it is possible in that sense. Okay, so basically this is basically our understanding of how we are, trying to answer to the previous points that already was indicated regarding the scenario. So at the end, and with that, I conclude just for you. So basically, this is a scenario that later I will come again about that. But basically, in our scenario, what we want is to envision this kind of secure enclaves that should be able to be offered in some sense, so that you can indicate the possibility to do certain operation over the data, data that maybe come from different data providers, and that they will be executed on a totally independent and secure environment, either for the processing or for the execution of a machine learning algorithms, and so on. And for that, we are already integrating certain tools and certain technology that will allow us to execute this in different kind of frameworks, if you like, as I already said, being TE or being other kind of secure enclave that we are interested in. For that, it's very important. One of the aspects that also was mentioned is that when we want to do this matching between consumers and providers, we need to have this semantic interoperability data models that allow us to really do the matching between all this, so that we should be able to describe not only the data itself, but also the security and privacy requirements that are associated to the access to that data, and also in the case of processing, what are the conditions where this processing should happen in order to be offered to the other entity, so that at the end we can have a real privacy-preserving collaborative environment in order to execute all these scenarios that I already mentioned. Okay, and that's all. I mean, there's other slides, but you will see later on the on the next presentation. Thank you so much, Antonio. Thanks. So I invite Peter and Antonio to go to the stage. So first, let's see if there's any question in Slido. I haven't seen any. So I don't see any.
There is one.
Sorry. 711?
But that's cheating when you're in the room.
I don't see. Grenander 1? No, it doesn't. Oh, so please, go ahead. Carol, please.
I shall say it verbally then. So with reference to the, I don't know if
Take this one, I take another one. No worries.
Thank you very much. So thank you very much for all of these presentations. Very interesting, very stimulating. The European Health Data Space figure I was looking at, and it seemed to me to be a very, optimistic approach from the point of view of technology meets real governance. So it didn't have any aspect of 5 safes governance framework, didn't have disclosure control, didn't have risk assessment, and so on. And these are the things that actually kill access to information in trusted research environments, because trusted research environments are not secure processing environments. They actually have the different layers. So I was wondering how this actually really relates to the road, hitting the rubber, hitting the road. It seemed to me to be, a wheel reinvention, but without the tires or the axle to actually make the wheels go round.
I think there is a reason why the timeline is a little less optimistic, I would say. There are already first projects that started defining, putting the rubber on the ground, so to say, for and even the shifting on the ground with, say, discovery part. So EHDS2 pilot has developed this Health DCAT AP profile, which will be mandatory for, say, resource level discovery or dataset level discovery. There was already a pilot of record level discovery in it. The initial data access mechanisms, because there are basically 2 access mechanisms in EHDS. One is the data permit that Jerome has explained, so data access application, which is then responded by the HDAP through the permit, or so-called data requesting, which is more of like a federated querying in a way that you ask a query and you get anonymized statistical information out. So both of those modes were also piloted. What? Is this something? Feel free to ask. I mean,
sorry, Jonathan Tertulix.
Sure.
I'm just thinking that those are going to be important mechanisms, but they're ones you can access.
I will get to it shortly. Yeah. So I'm going by that journey that basically that Jerome was showing on the slides. So the data access application mechanisms were piloted. It resulted in the application process modeled in definition of common forms or common structure, how you need to describe the projects. And then the pilot basically has taken a detour. The purpose of the HDS2 pilot was to really run the use cases on this. So we have set up ad hoc processing environments. They were not intentionally were not focused, and they should come up in TEDAS2 and potentially other subsequent projects. That these definitions of what is requirements for SPE, what is requirements for disclosure control, what are the requirements for that is disclosure control is basically also on the analysis of software that runs in DSPs, and as a part of the disclosure control, you need to also have certain guarantees there. So that's now in TEDAS2 that started this year, and that is a joint action of European member states. So basically each member state has then appointed some national body that is in charge of contributing their requirements, their designs. Finland is pretty active there. They have already a catalog of standards for, or they have a catalog of SPEs even that are accepted on their national level, that FinData is able to use. So these are inputs. This is not a result that you're asking for. These are just that's what I know. I'm just saying these are coming as input into the process of getting consensus. And because it at the end it requires quite a lot of technical definitions, the process will take quite some time to get the consensus.
Sorry.
Sure.
No. I mean, one thing that you mentioned, I think is quite important, is the idea of that at the end, we can have different tools. We can have, solution, maybe the data accesses, but the point is the governance. As you said, for me, the governance is very, very clear. It's one of the issues that we are, in the context of FTTAN, we are really thinking about, and they say, okay, I can provide tools, but how they are going to be used, how we can really make them work together, I would say, I'm saying. No? So that part, I think, is quite important. So,
well, yes, but that's also a stepwise approach, I would say, in the implementation of EHDS, because there are things that are already defined in the regulation that basically say the HDAP is the Health Data Access Body is responsible for getting the data, for providing the SPE and getting the data into the SPE. It is responsible for overseeing the process. HDAP is responsible for assessing the access applications. So there are aspects of this governance that are already on very high level, not detailed enough technically, but high level are covered in this user journey and data journey. And there is a series of implementing acts that is expected now, which should come based on the outcomes of TEDAS2 that should go into the technical specifications.
Maybe we can give the floor also to Jerome to comment a bit on the governance, taking the opportunity. Once
absolutely.
you finish, maybe you can have the faces of, the cameras.
Absolutely.
Sorry, what was it?
Jerome.
Yeah.
Yes. No, Peter, you were explaining very well the whole process that has been undertaken for the past 2 years now, when it comes to supporting implementation of EHDS. And as you said, the next output that is relevant to the question here is the technical specifications that will be developed by TEDAS. So on what are really a set of minimum requirements for skill processing environments to be eligible as one, let's just say, to be used as part of processing under the EHDS. So that's what we expect the project to help define, but it will not develop, for example, a reference implementations for supporting environments. The idea is as much as possible for those specifications to align with efforts like what was presented by Antonio as part of Titan. The idea is also not to have requirements that are so different from, frankly, what is the reality. You mentioned that those specifications are being led by colleagues in Finland, for example. These are entities that are already providing this kind of solutions. So we want to make sure that it matches what is already state of the art, what is really provided, but also hopefully even improve on those. There might be aspects and also some aspects in Finland that are not ideal. So hopefully we can also improve on those.
And maybe actually a couple more comments that I realized during Jerome talking. I mean, EHDS is rather specific from certain perspectives. First, it's incredibly powerful legal instrument because it's building a new legal basis. As Jerome pointed out, there are opt-out mechanisms envisioned. They are not in the regulation itself. They can be implemented by the member states. There is also possible additional safeguards to be implemented for 4 data types: genomic data, molecular data, biobank-related data, and wellness apps, where there can be, for instance, opt-in implemented by countries through these additional safeguards. And then, because it's such a powerful instrument, it comes with a lot of constraints. So it comes with governance architecture that in this highest level is defined in the regulation. It requires a fixed journey, basically, so you can't process data outside of SPEs, for instance. You can't download the data. You can't do many things with the data. So there is a balance. There are trade-offs, and it's important to also say that EHDS is not exclusive mechanism. There was a wave of panic coming through several groups just before the regulation passed through the European Parliament for the first time, because there was even a proposed amendment to make it exclusive one, and this was dismissed. So the EHDS will not tamper with the existing means, but the data holders, unless they fall into one of those exemptions, which are physical persons or micro enterprises, if they have the data, publicly funded data, their health data, that are falling into one of those, 20 categories that are mentioned in the regulation, will be obliged to participate as data holders or as so-called trusted data holders. Trusted data holders meaning that they have even expertise to propose decisions on the data access applications to the health data access bodies, which still enjoy their independence, so they can decide regardless of what the trusted data holder proposed. But there are like mechanisms that are already envisioned by this regulation on this high level.
Thank you. Yeah.
Please wait for the mic.
Because we were talking, my name is Marta Msidłowska. I work for Co-11 Center for IT and IP Law, just about trusted health data holders, and we were talking about SPEs. They can also, I think, provide SPEs, if I'm not
That is something that is now being clarified, and I think Jerome could comment on it more, because I think the current consolidated text of the regulation after the trialogue says that SPEs are provided by HDAPs, or HDAPs is responsible for providing the SPEs, and how the detailed exact wording ends up in the legal consolidation that is now happening, I can't tell.
I think, if I'm not mistaken, that there was written that in order to, for example, assess, because of course member states have to decide whether they want to have even this policy of trusted health data holders or not, there was one of the requirements was to be able to provide, if I'm not mistaken. But about SPs, I wanted to ask actually about something about EOSC Titan, because we of course talk about EHDS as one of the examples of already kind of in Article 50, if I'm not mistaken, in the current text, there are already specifications written about how the SP should look like from the organizational technical perspective, at least to some extent. But of course, a lot of, I don't know, I'm the lawyer in the room, so maybe a lot of people forget that actually the definition of SPs regulated in Article 2, I think 14 Data Governance Act.
DGA.
And the very important aspect of it, which I'm not sure, that's why I wanted to ask for the clarification about Titan. The very important aspect is that there has to be an entity that kind of controls, and we were discussing this already, this is a very important component, that they control everything what's happening there. So I wanted to ask, because I couldn't kind of catch this, if in Titan there will be some sort of entity that will control, and therefore whether this is SPE as provided in the Data Governance Act, or maybe some other processing environment. Because I think this is the important aspect that, for example, differentiates what DGA had like envisioned, and therefore what, for example, is already implemented in EHDS, and other environments similar to SPs.
in principle, in the architecture that we are defining now, the idea is that depending on what you mean by control, because control in a distributed system is a little bit discussion. But in any case, the idea will be two things there. First, that we will have a capability of accounting at the end of what is happening in the concrete ecosystem, call it a national level or whatever we can call the domain that we are managing there. And secondly, that there will be through in this case, the governance plane that basically I already mentioned, the control about who are the entities that are offering and what they are offering, and basically the agreement that are finally reached in order to do the processing. So there will be a certain kind of monitoring and control of what happened. There will be not a central entity, I would say in some sense. Exactly, a control plane, that's what you call the governance, following a little bit more the idea of a distributed environment for managing all the processing. At the end, part of the idea is to have a kind of orchestrator that basically allow you to say, okay, once you decide, the consumer and the producer, I would say in some sense, how to create the matching, and based on this matching, you are able to do the accounting in that sense. Or traceability, either traceability, because the idea is also to have traceability of the processing. Yep. So at the end, I think solve a little bit what you are thinking on.
Yeah, I'm very sorry that we reached the end. I think that there's another session starting right now. No? Or 5 minutes? Yeah, so let's take 5 minutes more, very quick questions. Please, go ahead. Say your name.
I think it's on. So I'm Simon Parker. I'm from the German Cancer Research Centre. On the previous discussion, actually, I think the timescales are a bit unoptimistic. There's already existing TREs for a decade, and we shouldn't be reinventing the wheel. But the question I really wanted to ask was about, you mentioned engagement of stakeholders, and I wondered, does that include patients and the public as well? Because the experience we had in the UK with care.data, for example, had a similar idea and fell apart because of a lack of engagement.
Definitely there is engagement on multiple levels. For instance, the EHDS assumes implementation of the transparency portal that is supposed to communicate what is being done with data in EHDS to the patients. There are, as far as I know, there are no, Jerome, are there any systematic mechanisms of patient engagement in the discussion of the EHDS regulation through the member states? Because this is an outcome of also the trialogue between the European Council, European Parliament, and the European Commission.
Not at this stage, but this has been foreseen. Obviously, citizens in general will be engaged with, so we'll have a communication campaign, so touching on what we've been discussing now, the secondaries, but also what EHDS offers when it comes to primary use, so the use of health data for your own care. So what it's trying to enable is for every citizen to have access to some of their data in a interoperable format. So for example, patient summary, e-prescriptions, medical imaging, discharge reports, so a series of we call services, but data types that you will be able to have access to, be able to share with any doctors or any medical professional you want to. You'll be able to, there's a series of rights that are established as well as part of EHDS when it comes to the use of the data for individual care that are then communicated as a whole, really. So the idea is that you get more rights now with the EHDS because of primary use, and then a whole communication as to what will be the benefits when it comes to having your data being used for other purposes. But we are mindful of examples where indeed this communication was insufficient or poorly done, how it indeed affected the success of the initiative. But I mentioned the kind of safeguards we're putting in place, so we're stressing that point obviously as well when we are presenting this to the general public and the relevant stakeholders, healthcare professionals, everyone. But one thing at a time. Unfortunately, we didn't have the time up to do so yet, as much as we should do, for sure.
I'm very sorry, but I think I have to cut because we are eating time from the others, right? So thank you very much for all the presentations and discussion. We are working also on a document that bring some ideas together of IGS and EOSC that we will share all of you. Thank you very much.
Thank you.